Hello, welcome to the Parkinson's Foundation Wellness Wednesday program, recognizing communication challenges in Parkinson's disease. I'm Krista Ellis, Community Program Manager for the Florida and Gulf Coast chapters of the Parkinson's Foundation. I'm tuning in from my home in Tampa, Florida, and we warmly welcome our many participants from across the United States, including Hawaii, as well as the UK and beyond. You are not alone, and your Parkinson's community is here with you today from near and far. The mission of the Parkinson's Foundation is to make lives better for people living with Parkinson's by improving care and advancing research today until there's a tomorrow without the disease. In everything we do, we build on the energy, experience, and passion of the global Parkinson's community. Our virtual PD Health at Home programs, including Mindfulness Mondays, Wellness Wednesdays, and Fitness Fridays, are inspired by you, our viewers. We look forward to sharing exciting new programs with you in the weeks and months ahead. Today's session will be recorded and archived on parkinson.org/PDHealth. It is here that you can also find all upcoming and past virtual programs and events. Before we get started, I'd love to know a little more about our audience today. You'll see a polling question appear on your screen. We'll pause for a moment so you can respond. What is your connection to Parkinson's disease? If you have any technical challenges with the poll or at any time, please use the Q&A icon and we'll respond to you right away. Great. Thanks for sharing this information with us. Looks like we've got 60% today of you are people living with Parkinson's disease, 20% caring for someone with PD. We've got 7% of you as healthcare professionals and 13% other. For those of you who wrote in other, please let us know who you are and what your role is in Parkinson's disease by entering it in the Q&A. Without further ado, we've got lots to learn today, so let's get started. I'm delighted to introduce today's speaker, Dr. Danielle Carns. Dr. Danielle Carns is currently completing her Neuropsychology Fellowship at the University of Miami Miller School of Medicine. Her primary areas of interest are in the fields of movement disorders and epilepsy. She began her specialty training in movement disorders at Rush University Medical Center Movement Disorders Clinic in 2015. Dr. Carns' research has focused on the impact of stress and genetics on cognition, the impact of gait and balance on cognition, and development of psychometric tests specific to Parkinson's disease. Dr. Carns recently submitted a grant proposal with a focus on developing an intervention for before, during, and after deep brain stimulation therapy. She is a member of the American Psychological Association and the International Neuropsychological Society. Please join me in welcoming our speaker today, Dr. Danielle Carns.
Thank you so much for that introduction. I'm really happy to be welcomed back by the Foundation to give another talk. This is something that I'm definitely passionate about, so I'm really happy to be present with you all today in discussing communication challenges in Parkinson's disease. So just some housekeeping before we get started, and already technological some issues here, so bear with me. So I have no financial disclosures. And today I'm going to be talking about the communication challenges that a lot of Parkinson's patients and caregivers and loved ones face as the disease progresses. So we're going to meet three big objectives. One is learning more about what effective communication is, how Parkinson's pathology can impact one's ability to communicate. And then, of course, one of the biggest pieces of this presentation is going to be strategies and treatments that everyone, including patients with Parkinson's, can utilize to kind of mitigate these negative effects. To do this, I'm going to start by talking about effective communication. So I'm going to talk, generally about types of communication, what cooperative communication means, And then I'm going to go into the specifics about Parkinson's disease. I will not be giving an anatomy lesson, I promise. I just want to go over some of the big pieces of Parkinson's neuropathologically to discuss the motor and non-motor symptoms that really make communication a challenge. Then, like I previously mentioned, we'll be talking about strategies to reduce those barriers. So to get started, I want to talk about what is communication. So when we communicate with one another, we're sharing meaning. We do this verbally, by talking, non-verbally. I'm sure many people, even colleagues of mine would say, Dr. Carns often wears her feelings on her face. So, facial expressions, body language, and written communication as well. All of these things are comprised under a kind of a general category that I like to call and that researchers refer to as conventional communication. This is what we think of when we think of general human language. This is comprised of three big pieces, and depending on the literature, it may vary. But what I wanted to share with you is, natural gestures and shared intentions. That is, we're innately born with, learning how to point. Babies know how to point and get someone's attention. What makes that really productive is shared intention, which means you have a common ground from which you are communicating. I'm sure many people on this call have at some point been walking along with someone and they see something that catches their eye and they point. And if you are not, if you don't share a common ground or understanding of, what's going on in your mind, the person standing next to you might, respond like, what are you talking about? But if you have that common ground, then you can say, oh yeah, that, is that what you were talking about? So that part is really, really important when you're engaging in some nonverbal communication. Cultural learning is another big piece. So we are all from different walks of life, different backgrounds, and the environment that we are raised in, that we learn our language varies person to person and culturally. So that's another big piece that impacts human language. Meaning in one culture may have a completely different meaning in another. And then imitation. So imitation is one of those things that impacts learning, right? We watch people, observe people, and imitate them. Additionally, I like to take that a step further. And when people are engaged in really good communication, they're actively listening, oftentimes we'll see people imitating each other unconsciously. And what they do is their body shifts and changes and matches the person across from them. And I didn't necessarily buy too much into that when I first said, I was like, I don't do that. And then once you start observing people and yourself, you actually do realize that these things do happen. So now a quick question. I just want to get a good idea of, what types of communications are most problematic for people on this call. For caregivers, this could be something that you observe in, the person that you're caring for, or if you're a loved one, what you notice being the most problematic for the individual in your life who has Parkinson's. All right, so verbal and then all of the above. Okay, so verbal is the biggest one, which I'm going to talk about all of these things in a moment, but I think that, thank you so much for giving me that feedback. It just helps me kind of adjust for the talk. So, all right, let's get through here. All right, so in talking about specific aspects of communication that make communicating with others effective, right? We want to be effective communicators. One of the things that really stands out when people are effectively communicating is being cooperative and communicating in a cooperative way. The key component to that is something called shared intentionality. Like I mentioned previously with the, the gesturing, this is something that kind of establishes a common ground for patients and loved ones and just people in general, okay? Almost as if you're working toward a common goal. Shared intentionality, I break it down into 3 separate parts. And these are important to notice for individuals with Parkinson's disease because of the motor and non-motor problems that they face. So the first thing I want to talk about are cognitive skills that enable social behaviors. So our thinking abilities, so our language abilities, our attention, our executive functioning are among the cognitive skills, plus others, that allow us to engage socially and to communicate. In addition, joint attention and intention, so intentionally focusing and attending to a common object or topic of conversation with another person is also really important. If the networks in our brain are not communicating well, that can be really problematic because we're not going to be able to follow the course of a conversation if, we're thinking about, other things or we're distracted for a myriad of reasons. And then finally, pro-social motivation. So kind of engaging with someone and in promoting well-being, right? So you're working with someone to help them out, to engage with them and to cooperate and communicate. So what about Parkinson's disease makes establishing this shared intentionality so challenging, right? This key factor in cooperative communication. Well, it boils down to a combination of cognitive and motor symptoms, okay? So patients with Parkinson's experience anatomical changes in dopamine networks, okay? This impacts kind of the frontal, so the front of the brain, and then in the middle of the brain, the subcortical area, that functioning, okay? There are pathways that kind of allow the brain to communicate. I like to think of these networks as almost like electrical wires. So, if you're living in a big city and you notice, the communication is working perfectly fine, but then in a storm, you'll have, maybe across the street, the power's out, right? So there's kind of a mismatch of communication. That's what happens with the dopamine networks in the brain, right? All of the things are there, they're just not working as they should. And that's what contributes to these motor and non-motor symptoms. So we're going to start talking about the motor symptoms that may impact one's ability to communicate. So individuals with a masked face, if you can't see what a person is thinking, if they're not smiling or they can't engage with you and you think that they're kind of disengaged by the look on their face, that can really, really prevent that cooperative communication because someone might not feel like you're listening or interested. Soft speech is another one. Makes it difficult for Parkinson's patients to actually speak to a level that others can hear them. Regarding written communication, we have micrographia and tremor, so that tiny writing and then presence of a tremor, which of course makes writing difficult and sometimes not legible. Other things that, really impact kind of nonverbal communication, the dyskinesia and dystonia. So when we're engaging with people, I mentioned that body language, sometimes we imitate other people. You can't do that whenever you have, these involuntary movements or kind of twisting of areas of your body, like with dystonia, or even cramping that might cause pain, right? So that makes that really problematic. In addition to that, postural inability, stooped posture. So not being able to exert a relaxed posture can make that connection with another person really challenging, right? So those are some of the motor symptoms that can make that effective communication pretty challenging. So looking at non-motor symptoms on the right side of the screen, you see that we have cognitive changes. Most patients, approximately, and depending on the literature, about 30% have cognitive changes at some point, and mood disturbances as well. So when we have those cognitive changes, oftentimes our speaking and our ability to process information is much slower. And I'll talk about that in a moment, specifically with regard to white matter changes that makes our ability to process information harder. So those electrical wires that I was talking about, it's almost like and I'm not sure the name of it, but the black outer portion of the electrical wires, that's not there, right? So, you know, it's exposed to the elements and you're going to have shorts and things like that, right? So when that happens, we're not communicating to different areas of our brain as we should. And that disconnect is what can contribute to some changes. So then we have mood disturbances. So anxiety and depression are very, common in Parkinson's patients. A very large percentage of patients will experience mood disturbances at some point. Impulse control disorders, also something that can really, really be challenging for engaging in communication effectively. If you feel embarrassed for acting in a particular way, or you feel uncomfortable about something, that can make it really, really challenging as well. And then not to mention the hallucinations. Some patients, when they're on dopamine replacement therapy, can experience visual hallucinations. And you can imagine if you're standing in a room talking to someone and there are animals or maybe someone in Mardi Gras attire. I mean, I've heard a whole bunch of different things, but it really is distracting. And so when you already have cognitive deficits and you add these things to it, it just is almost like a kind of a snowballing effect. It makes it super, super hard. And when you can't attend and you're not processing and speaking as quickly, it can be very, very frustrating, which again can contribute to more of those symptoms of anxiety and or depression. So I have a picture here of the brain, and what you see are the dopamine networks. So I'm a visual person. I just wanted to provide this so you kind of can see what I'm talking about. So I like to think of these arrows as, what I was talking about, the electrical wires, my kind of metaphor there, that connect different areas of the brain. So this area of the brain, the substantia nigra, is where kind of the problem essentially begins. So your brain is not producing enough dopamine, right? So you're not getting these networks, these electrical wires here stimulated, right? So this part of the brain is not talking to this part of the brain well. And then areas like the mesolimbic pathway are also implicated because dopamine stimulates those areas as well, among other neurotransmitters, but the focus is on dopamine here. But you can see how these projections go from the middle of the brain to the frontal area of the brain. The front area of your brain is what is, most people associate attentional control, executive functioning. So one's ability to plan and organize, decision making, initiating things. These are all really important roles in communication that are from this particular area. So you can see that in Parkinson's disease, when we don't have a smooth communication in those networks, we have difficulty engaging with others. So I want to highlight a couple of things. So intentionality, intentional behaviors. That is something that is impacted in those frontal areas that I just talked about. So deciding what to do, when to do it, and then initiating those things. So initiating communication can be impacted. Furthermore, those electrical wires, those networks that I was talking about, when they're not working properly, they're not connecting both sides of the hemisphere, essentially. Sometimes. So intentional action is one of those things that involves communication from both sides. So if the power's out on one side, that communication's not going to be fluid, and there's going to be a disconnect that prevents people from initiating speech and engaging in effective communication. All right, so we have a question here. Have you experienced difficulty with focus, concentration, organization, or slowness? And again, if you do not have Parkinson's disease, you can respond, based on the person you're caring for or the loved one in your life that has Parkinson's disease, things that you've noticed. Okay. Yes. So this just goes to show, so 90% have experienced problems with these things or have noticed these problems in their loved one. I am not surprised by that. These are very common symptoms that patients with Parkinson's have. And it's always good to paint a picture for viewers to really, show that I'm not the only one. My loved one is not the only one with these issues. All right. So now I want to talk about motivation and apathy. So motivation is something, I talked about with shared intentionality, pro-social motivation. So engaging with someone, working toward a common goal or away from something, right? So motivation involves kind of a cost-benefit analysis. So areas of the brain that determine whether something is rewarding or not are implicated with those dopamine disruptions. So what we have is a lack of motivation. When we have motivation, that's a symptom, right? So decreased motivation is a symptom. As Parkinson's progresses and you see white matter network disruptions, so the electrical wires are not communicating well, there's some power outages throughout, you can get a clinical syndrome called apathy. So this is something that oftentimes has been confused with depression, and they are different entities. So apathy involves behavioral, emotional, and cognitive features. And when someone is apathetic, it's almost like you may be engaging with a wall, essentially. There's no interest. They can't be motivated. They have a flattened affect, and they really seem indifferent. So Parkinson's patients, this occurs in 16.5% to 42%. And that's a big range because it varies in the literature based on the sample, but regardless, you can see this is something that occurs often in Parkinson's patients. And you can imagine that when you are talking to someone like that, it can be really hard to feel like they want to engage with you. When that happens, you see isolative behaviors, withdrawal, someone not wanting to engage in social activities, which also implicates outcomes. So we have to really work to engage these patients to make sure that, we're doing all that we can to improve their quality of life and outcomes of Parkinson's. So now I want to talk about the most common challenges that Parkinson's patients have, per the literature, have noted. So the most common, of course, and no surprise, are cognitive deficits in those frontal areas of the brain. So things like distractibility. And again, that could be because of hallucinations, that could be for a myriad of reasons, just inattentiveness, ruminative thoughts, the list goes on. So then inattention, so difficulty sustaining attention, those two kind of go hand in hand. And then we have sequencing thoughts at the bottom there. So sequencing thoughts is when you're listening to someone engage in conversation, are you able to logically follow what they're saying so that you can respond? Do you completely understand what they're saying so that you can formulate a response? So all of these things are a little multifaceted, but those are the primary cognitive problems. In addition, there is word finding difficulty. So this is that tip of the tongue phenomena. So, when you're in the middle of a conversation and you're talking and, oh, that word, it is right there. I can't think of it, but it's on the tip of my tongue. That happens frequently in Parkinson's patients as well. And primarily you see this in patients whose primary motor concerns are rigidity and the inability to move. So kind of that akinetic, rigid motor dysfunction. Initiating speech movements is another issue. So again, I can't stress, this is a motor and non-motor problem, right? So it's not one or the other. These things kind of come hand in hand. In the front part of the brain, that's kind of where our, motor areas are, and then the fine tuning happens in the subcortical areas, the basal ganglia. So we have disruptions in both places. So you can imagine initiating speech movements, among other movements, is a big issue. And finally, processing and comprehending complex grammar and syntax. That kind of goes with, not being able to follow the course of conversation and register everything that's being said. These are really important things to talk about, and communication challenges, I cannot stress enough, are so important to learn about and treat, because about 80 to 90% of Parkinson's patients are going to have some sort of vocal change. Your voice could become soft. You could have a vocal tremor. There are a multitude of things that could happen, disfluent speech. And these really impact your day-to-day life and your quality of life. Additionally, 45 to 50% of patients have articulation deficits. And these are all things that, we can work with, okay? We may not be able to get you back to where you were, but we can give you strategies to help offset some of these challenges and improve your daily life, your communication abilities, which will definitely impact your outcomes. So here's another question. Of the most common symptoms, which is the most troublesome for you or your loved one? Okay, so word finding difficulty and distractibility or inattention are kind of the big ones. And again, those are things that, are multifaceted. When we think of distractibility and inattention, things that can kind of overlap with that are our mood symptoms. So there are symptoms of depression and symptoms of anxiety that can look like cognitive symptoms. Those are all treatable, of course. So I always tell everyone, if you have a mood problem, that's actually great because we can treat that, right? So those are things to keep in mind. And then for word finding difficulty, there are strategies that I'll talk about in a moment to kind of help with that as well. So I want to provide some testimonials. I think this is always just a great way to paint a picture that, one, you're not alone. And two, these are things that, other patients and families are struggling with. Parkinson's disease is not a disease of an individual. It is a disease of families. These symptoms impact everyone. Multiple people are having role changes. And that can be really, really challenging to deal with. So the testimonials I have here, the one on the lower left-hand side says, by the time you finished, the subject has changed and they haven't waited for your answer to come out. So this patient had difficulty speaking quickly. And so by the time, he or she would register their thoughts, the topic of conversation would change. You can imagine how that would make someone feel. When you feel like you're not included, what you say is not important because you can't get it out fast enough. It really can contribute to significant symptoms of frustration and those mood symptoms, anxiety. I don't want to engage with people because they don't want to hear what I have to say. Or symptoms of depression. I can't do this. So then I want to take your attention to the upper right part of the screen to that testimonial. It says, sometimes I just can't do the conversation. I just say, I hope they don't talk to us, They'll just say, hello, how are you, and walk away. So that kind of highlights, one's feeling of, maybe they had been trying for a while to engage with people, but it's just too hard. They didn't have the strategies in place to allow them to feel comfortable engaging. This is so important, and I've been talking about communication and aspects of Parkinson's that make it challenging, but Why is this such a big deal? Well, as a provider, I can say that, with my patients, I truly, truly appreciate when they tell me everything, because guess what? We don't know you like you know yourself. We cannot, determine what goes on in your day-to-day life. We only know you when you're in the clinic with us. So when you have a symptom, it's really important to provide that to your providers, because 30% of patients who experience preventable adverse events are due to miscommunication. So your provider not maybe treating the correct thing, or not knowing of a particular side effect, or there are a multitude of things that we can't see from clinical evaluations, testing, etc. So it's extremely important to open that communication with your provider. Additionally, one of the things that is really important when talking with providers is there's really sensitive information out there, and it can be really uncomfortable. If you are not comfortable talking with a loved one in the room or a caregiver, maybe write things down. I know that these are sensitive things, but they're all very important for your well-being. Additionally, last thing I talk about medical care is, individuals when they come to us, and sometimes they're experiencing, down mood, or maybe they're a little slower or something like that, they attribute it to normal aging, right? We're just getting older, and I'm a little slower, and not thinking as quickly, and my friend who doesn't have Parkinson's disease, they have symptoms similar to that, so it's fine, it's just normal aging. I urge everyone to not fall in that category. What is happening to you may or may not be normal or abnormal aging, but leave it up to the providers. Let them know, I feel a little slower. Because at the end of the day, there is a process going on that even those who are aging normally, they don't have that, right? So while the symptoms may be consistent, it could be the result of processes going on, and that's really important for your treatment providers to know, because we want to be able to give you the absolute best care possible, okay? Miscommunication also impacts your relationships. So I mentioned Parkinson's disease is not a disease of individuals. It is a disease that impacts families. I have some statistics here from the Gottman Institute. This is not specific to Parkinson's, but bear with me, you'll know why. I put these here in a second. So 65% of divorces are due to miscommunication. And there are 4 pieces that they highlight that, contribute to this miscommunication. Criticism, criticizing another person, criticizing yourself. This could also overlap with some of those communication deficits that we have in Parkinson's, right? Maybe someone feels more critical of themselves because they're not communicating like they used to, especially for people who, as professionals, maybe they did that for their job, so they're more critical and they're not as engaged now as a result. Or maybe they feel that their loved one is being more critical of them because they can't get things out as fast or as fluidly. Contempt, so not feeling like worthwhile, right? Maybe they don't feel like I'm worthwhile because I can't communicate anymore. Maybe they, maybe I feel bad because they can't communicate well and I don't know what to do. Defensiveness, that's another one. You can imagine in Parkinson's, defensiveness and stonewalling can look like apathy a little bit. So when you think of stonewalling, think of you're talking to a wall, right? You're not getting anything back, you're putting so much in. That can happen with apathy. So I wanted to bring that up because a lot of these symptoms that contribute to poor relationship outcomes are overlapping. And of course, in Parkinson's, these are pathological, right? This is not something that they're wanting to do. But it's something that happens. This is also important, understanding these communication deficits, because if you're a caregiver, your care actually directly, in your actually ability to be a caregiver, directly impacts the Parkinson's patient's outcomes, okay? So if you're burnt out, you're likely not giving them the care that they need, and their outcomes are worse. That being said, Often we see in Parkinson's patients, maybe these are individuals, everyone goes from being super independent as the disease progresses to needing more care. That can be really, really hard. That shift in roles to, for some people being a provider, being the person who took care of everything. Now that role has changed. And they're not used to asking for things and saying, hey, I need this. That can be a big shift that can cause kind of, the caregiver to not specifically know what the patient needs. And therefore they're spinning their wheels, right? Helping with things that they don't necessarily, that aren't impacting them as much. So you can see that relationship there too. Finally, about caregivers, caregiving is extremely expensive. So oftentimes this falls to a close loved one. That encompasses a role change as well. So it's really important to open up the modes of communication to talk about these things. Hey, I might, be the caregiver for my loved one, but I'm still the spouse, right? I'm not just, it's not like a patient and a caregiver. It's still, partner and partner. So trying to make sure that you're communicating all needs, so health and emotional, for both parties. It's as important for the caregiver as it is for the patient. So now I have a question about doctor's appointments. Has anyone ever neglected to share information because you were maybe embarrassed of that symptom? Or maybe you thought your symptoms were due to normal aging? Okay. So I see that some people have experienced, 39% have experienced one or two of those things. I'm glad that the gross majority have actually not experienced that. That actually is very refreshing for me. So fantastic. All right. So now for the big piece of this. So strategies, programs, and resources. All of the things that I'm going to talk about in a moment regarding communication strategies, things to implement, do, not do, as well as programs, are all going to be made available or have been made available to the facilitators. I made a handout that has, some of the information that I've presented. So, you can go back, check that out, as well as the things that I'm about to present to you. It incorporates national resources as well. I know that not everyone is from the Miami area, so I wanted to include kind of things from around the country to kind of, offset that. So how do we improve communication? So, this first slide here is for everyone, providers, families, patients, caregivers. And it really involves just increasing your empathy, putting yourself in another person's shoes, okay? Just because there are changes, it doesn't mean the person is not there, right? Just because they can't speak as fast, it doesn't mean that it's a completely new person in front of you. So it's important to kind of put yourself in their shoes. How would you feel? Make sure that when you're talking with people, you're actively listening, okay? I can't stress this enough. Do not rush the person speaking. No one needs to hurry. If you're engaged in a casual conversation, just give people time, okay? It's also important for patients that if you are listening to someone and you missed something, have them repeat what they've said, or ask them to speak more slowly. It's important you do that so they know, it's not rude or anything like that. It just helps people know, they're listening, but I need to check myself. I need to speak a little slower, and that's perfectly fine. So that's something that I really encourage everyone to do. It's important to encourage everyone's involvement in the conversation as well. You can do this if you know that, the loved one that you're talking with has significant vocal deficits, speech problems. The receptive language is there, so their ability to comprehend, to understand, it's there, but it's the expressive language, so their ability to express themselves verbally or non-verbally, that's the problem. You can ask closed-ended questions, okay? So questions that require a yes or no answer, okay? It's easy to nod your head as well, shake your head, or say one word, okay? That's just something that, I think would be really helpful for a lot of patients. Another thing is for caregivers and providers and families. So I know that for Parkinson's patients, using open body language can be really challenging, especially if you have those dyskinetic movements, right? You have dystonia, you have a tremor. That's very hard to have a relaxed body posture sometimes. But for caregivers, this is really important because when a patient sees you relaxed, when they see you engaged and observing them and listening, it's really important. It can make their anxiety be reduced. It can make them feel more comfortable, because we know when people are stressed out, generally their tremor worsens. So try to decrease the stress of having a conversation, because I guarantee that patient does not need any additional stress right then, okay? So then there are environmental changes. So these are also for, social events, or even if you're in the house. When someone's talking, turn the TV down. Limit all of those extra noises that we don't need, that are super distracting. And, for someone who has a hard time projecting their voice, you're not going to be able to hear them. So these are some simple things in the environment to kind of modify to make sure that they have the best environment possible to make them feel comfortable enough to respond. Turning off mobile phones as well. A lot of research has recently been done on social media, use of cell phones, and they're a big, big distractor. Especially if you have, young people in the home, it's important for them to, hey, when mom or dad or grandpa's talking, the phone's gotta go. That can really be helpful because again, it just, lets people know you're interested, you're engaged, you're not distracted. And so that's really important. Also, I think it's important to have good lighting. When people are trying to figure out what you're saying, looking at your lips, your face, judging, the expression on your face, your body language, all of that, being able to see that really lets people know for sure that you're engaged with them. And then finally, for people who have writing difficulty, if you are, you have significant tremor, micrographia, maybe using a computer, if you have to write a letter for written communication, can be really helpful because then it's legible and you can do spell check and all of those other things as well. So these next strategies are specifically for patients. So, I went through, increasing the empathy, environmental changes. These are really just to facilitate a good environment for patients to communicate. So how do they do that when they have all of these issues? Well, the number one thing that I think is important is finding an alternate way to express interest, okay? So, this could be verbal and nonverbal. If you have a hard time speaking, maybe bring paper and pen with you. If you're having a hard time and you can't get the words out quickly, maybe just write things down. Maybe have some whiteboards throughout the home. Things like that can be really helpful. For patients also, specifically with vocal problems, it's important to speak slowly. Use short phrases and take your time, okay? Telegraphic speech, so, leaving out unnecessary words instead of saying, we need to go, just say, we go. It gets the point across and it's not as energetically taxing. It doesn't require as much cognitive demand as a much longer, grammatically intense sentence would. So those are really important strategies as well. One thing too, I mentioned speaking slowly. but being patient with yourself and allowing time. So that kind of goes with the speaking slowly. This is really important because when we are all trying to, I mean, we live in a very fast-paced world, but in general, when people are trying to communicate and we talk really fast, we're doing a million things, we can increase our anxiety, just baseline. So you can imagine that a patient who has cognitive deficits, who is having production problems, vocal production issues, this could be really anxiety provoking. So learning to speak slowly and set your own pace. I can't stress that enough. When you set your own pace and you practice talking at that pace, it will become very second nature and can really reduce anxiety and provide more of a fluid communication pattern. Anything that we can do to decrease presence of stressors that could make your symptoms worse, extremely important. As the disease progresses, as changes happen, it's really important to constantly keep in touch with your loved ones as well. Openly communicate these challenges, right? Practice communicating with them. Say, hey, listen, I'm having a hard time with this. We need to think of strategies so I can let you know in social situations that I'm having a hard time, you maybe can intervene. Or what can I do? Or how can I say this to get my point across better? I think that, establishing strategies as well as coping skills can make engaging socially much more manageable. If you are involved with speech therapy, which I'll talk about in a moment, making sure that you assign specific times to practice those skills. Practice makes perfect almost. So when you're practicing these skills, they more often become second nature, and that's what we want. We don't want to be in a situation and we're frantically looking and pulling for things last minute. We want it to just come easily, and that comes with a lot of practice. So again, talking with loved ones, practicing with loved ones, and then practicing on your own those communication skills and strategies. Preparing for medical visits is another big one. We are aware that there are issues. However, and as a neuropsychologist, we're very lucky. We get hours and hours with our patients, so we get to really know you. But a lot of providers don't get that time. They have 15, 30 minutes. They have specific things that they do, specific things that they focus on. And it may distract you or derail your thinking when you want to bring something up, right? Because it's such a well-oiled process, essentially. And there are different disciplines that, practice from different theoretical orientations. So for medical providers, it's more of a medical model. For me, it's a biopsychosocial. So we all have different lenses from which we look at. One is not better than the other. But it really impacts the questions that we ask. So it's important to bring all of your questions up to your providers. Because of that time constraint often in sessions, it's really helpful to have questions prepared. If you can't write, have someone help you. If you're not comfortable, maybe type it up and email them. Bringing a loved one or caregiver to appointments can be really helpful, with the caveat that you feel comfortable enough with them to disclose all of your problems. Some patients do not like to do that because they feel that they want to be as independent as possible, and they may not want their loved one to know that maybe I'm not doing so hot right now. And so it's really important to make sure that that's not going to prevent you from engaging with your providers in a way that could improve treatment, okay? Speaking of treatment, so now I'm going to talk a little bit about some treatment options. So speech therapy is fantastic. Of course, I'm not a speech therapist, but I 100%, I think they're fantastic when you're experiencing communication deficits, getting strategies. I mean, they can help caregivers and partners kind of learn different ways to interact and improve communication. So I think they're absolutely fantastic. And I encourage you, if you're not seeing a speech therapist, you're having significant difficulty, that's something to really consider. Given that we are in a pandemic right now and, things are very virtual like this talk, I've actually researched and have seen that online interventions for speech therapy are actually consistent with what we see in in-person care, okay? All right, so a couple more things before we move on. So one of the things that is also important, I know we have this at the University of Miami, it's a mindfulness group, but I'm sure they're, in other areas of the country as well. Mindfulness can help focus your attention, reduce ruminative thoughts and judgmental thinking. Reducing judgmental thinking is extremely important. It can help people, want to engage socially and be less critical of themselves. And then, of course, individual therapy. So cognitive behavioral therapy is really great resource for individuals experiencing depression and anxiety, and can really help break that cycle of maladaptive thoughts, bad feelings, and then maladaptive behaviors that contribute to the bad thoughts. It can break that cycle. So 2 quick things before I conclude. I wanted to talk about singing. So singing has actually helped individuals with Parkinson's maintain vocal skills and slow deterioration. So 3-month singing-based interventions have been shown to improve vocal intensity, expiration, and voice-related quality of life as measured from the Unified Parkinson's Disease Rating Scale. So singing, if you're interested, has been shown to be really helpful. And then finally, I'm from Chicago, and so Second City does this fantastic, it was a 12-week class that really helped Parkinson's patients learn how to do improv. And it showed that it improved their quality of life. And, again, their activities of daily living per the UPDRS were improved. And this was for people at different disease stages. This is also helpful for just adults in aging categories as well. It just helps to improve their overall health. This last slide that I have is really just going over the biopsychosocial aspect of kind of the way I conceptualize things. And the take-home point from this slide is communicate with your providers. Make sure you're managing your symptoms of anxiety. If you're having sexual dysfunction, if you're having relationship problems, if you're being judgmental, there's a myriad of treatments available that you can see here that are really helpful. And then again, outcomes are best in Parkinson's for patients who are socially engaged. So the more socially active you are, the better your outcomes. So communication is really important for that reason alone. So I'll leave you with this quote from George Bernard Shaw: "The single biggest problem in communication skills is the illusion that it has taken place." Thank you.
Great, thank you so much, Dr. Carns. We really appreciate you sharing your expertise with us and for this wonderful presentation. Dr. Carns, we've received quite a few really wonderful questions that I'd like to take some time to address those now.
Okay.
The first question that came in was, how can I communicate about difficult topics with my wife? Are there ways to improve empathy, patience, and understanding?
So I think that's a fantastic question, and I want to start with some good news here. If your wife is your caregiver, research shows that female caregivers, as disease progresses, actually are much more empathetic. So the relationship generally improves. So I wanted to start with that. But ways to increase empathy, I think that one of the biggest things for everyone is to put yourself in another person's shoes. So put yourself in your wife's shoes, right? Have her put herself in yours and really open that communication. If that's something that's really challenging, for a lot of people it really is, because you don't really know what to say. Couples therapy, I can't stress that enough, can be really helpful to develop particular strategies. But just, the takeaway from that is just talk to her, make sure that, you're addressing, hey, listen, I know that this is a change for both of us, and use that I language, don't do the you language, make it kind of an us, like we need to collectively work together to make some changes. I hope that answered the question.
Yes, thank you. And along those lines, we had a question come in that they ask, how can I find someone in the Parkinson's medical community who's actually willing to talk with my person with Parkinson's and I about communication issues? And she writes, I no longer bring the subject up because the answer they have given us is, you need a marriage counselor. I'm disappointed that we get pushed away when the communication issues I discuss are Parkinson's related.
So one of the things that I would encourage is finding a neuropsychologist that will engage in therapy. I've worked with patients in the past to talk about these things, because it's true, it is a Parkinson's problem. And so if you generally go to a counselor, they're amazing. Marriage counselors are absolutely fantastic, but they might not know, like I mentioned, the marital discourse and how the symptoms kind of overlap. They may not realize that, and they may think it's a little bit of an easier fix when in reality it's a pathological change. So I think that reaching out to neuropsychologists who engage in interventions are really important. We do that at the University of Miami. I'm not sure where you're at, but that's something to definitely consider, but a neuropsychologist for sure.
Thank you, Dr. Carns. Another question, these communication challenges seem to only occur when I am off rather than all the time. Or do you find that these challenges are continuous regardless of whether levodopa is working?
I think that's an excellent question. So in the literature, the results are mixed. So, when you're on a dopamine agonist, the therapy, it can improve symptoms and then induce symptoms, right? So there's kind of some mixed results. I don't have an exact answer for you there, but I think it's also an individual thing. And so it varies. So again, I don't have a specific answer for you, but if that's something you notice, bring it up with your provider. If you notice that when you're off, that's when it happens, and when you're on, it's better. Bring that up to your neurologist, because they can certainly modify medications and work with you to prevent some side effects and improve symptoms.
Great, thank you for that. And it is quite unique, and I appreciate you highlighting that. Is there another strategy for asking a person to repeat a sentence? Being mindful of possible cognitive impairment. I don't want to cause frustration.
So I think that is, I'm really happy that was brought up. So, because when we're engaging with people, we want to kind of keep the flow of the conversation going. But one thing people don't realize is that when you don't respond, that actually looks worse than when you say, hey, can you repeat that? I didn't catch it. Can you speak more slowly so I can understand it better? Sorry. They're not going to get frustrated. In my experience, and when I've talked to people, it actually makes them, again, check themselves and say, oh, wait, yeah, I'm so sorry. Let me rephrase that for you. And it shows that you're being attentive and interested, which actually has, that's what everyone wants, right? Everyone wants to be heard. So I think that just bringing that up and knowing that it's not a big deal, for the other person.
One of the questions that came through during the registration, they ask, how can I effectively communicate and respond to delusions and paranoia?
So I was going to talk a little bit about that, and I didn't bring it up, but it's a really important question. So when patients with Parkinson's have those symptoms, and the question again was, how do I manage communicating with someone who has these, or as the person who has them?
I believe the question's coming from an individual caring for someone with Parkinson's disease who's living with delusions and paranoia, and how she or he could respond in those times of delusions and or paranoia.
Okay. I think one of the biggest things when we're engaging with someone who is experiencing a delusion or like paranoia, for example, a common one is that the spouse, is cheating on someone else. For the caregiver, it's really important to, one, really learn how to self-regulate, right? It's really hard when you see someone you love and you would never do something like that, kind of be more accusatory. And so I think that kind of taking a step back and reminding yourself that this is the disease process talking, this is not the patient, can really help you to regulate. Often we see when people are more responsive and they deny that, it actually makes the patient kind of more aroused in that sense. So, kind of just being calm and saying, this is just the Parkinson's, and just, not trying to invalidate the patient by any way, say, this is actually a very real feeling you're experiencing. And just trying not to overreact. You're likely never going to get the response that you want, which is understanding, because these things are very real for the patient. So it really is important for you to make sure you're taking care of yourself emotionally and limiting, kind of increasing that arousal of the patient. So I would recommend mindfulness, engaging in that to kind of just ground yourself when those things happen.
Thank you. And our last question for today's webinar. I always used to go with my person with Parkinson's to appointments pre-pandemic, but since the pandemic, his doctor's offices no longer allow me to come in. I'm troubled that certain issues are not discussed. Can you comment on that?
Yes, this pandemic has been such an interesting time for us, because we want to make sure everyone's safe. But that's a really good point, especially if, caregivers often acknowledge things that the patients don't necessarily see. They see the change in personalities and all of those things. So if you are concerned that that's your questions aren't being met, maybe providing a written sheet to a nurse or a staff member to give to the doctor, if you don't think that, the patient would be willing to give that, just to make sure that, these are concerns that you're bringing up, and the provider gets it, because everything that you have to say is extremely important for treatment. And, it's helpful for us as providers to manage symptoms when we have all the information. So I would definitely recommend reaching out on My Chart, UHealth, email, or giving something written to a nurse or technician, just to make sure that the provider gets that information.
That's a great suggestion. So thank you so much for that great answer. This concludes our Q&A segment for today's presentation. Dr. Carns, we can't thank you enough for joining us today and sharing this valuable information with the Parkinson's disease community. Today's session has been recorded and will be archived on the Parkinson's Foundation website at parkinson.org/pdhealth. It is here where you will also find all upcoming PD Health at Home programs, including our Mindfulness Mondays, Wellness Wednesdays, and Fitness Fridays. If you had a question today that was not answered, please know we provide free resources, including our website, parkinson.org, educational book series, webinars, podcasts, our hospitalization safety kit called Aware and Care, and our toll-free bilingual helpline, 1-800-4PD-INFO, which is staffed by Parkinson specialists. To learn more about our resources and our upcoming virtual events, visit our website at parkinson.org or call our helpline at 1-800-4PD-INFO. Last but not least, we hope you'll join us for next week's PD Health at Home programs, including our Mindfulness Monday and our Wellness Wednesday program, Technology Can Work for You. Until then, we thank you again for joining us all across the United States and the UK, and hope you continue to stay well. Thank you so much.